Good morning. Thank you guys all for coming today. I'm Katie Rasmussen.
I'm Emily Ozzie.
And today we're going to talk to you about a device called Medication on Demand. Now, we first started this project in our nurse residency program as our evidence-based research project. But the more research we found, the more we were like, wow, this could really make a positive impact for our patients. But not just our patients, but for the staff, and we thought for our overall healthcare system. Now, our focus is on the post-surgical patient and on their pain control. And it takes the nurse on average about 11 minutes to pass an as-needed pain medication. But we all know interruptions happen. I work on a post-surgical unit. I can vouch for this firsthand. When you're passing medication, let's say your phone goes off and it's the doctor you've been trying to get a hold of for another patient. Or the call light goes off and in the room next door the patient is now throwing up. Or the call light goes off down the hall and your patient has fallen. So that 11 minutes can quickly turn into 20 minutes, can quickly turn into 30 minutes, all the while your patient is sitting in pain. Whereas if they were using the MOD device, they get that peace of mind of knowing when their next pain pill is coming. They get the control and autonomy of deciding if they want it. Plus, this provides them a safe learning environment to make that transition from hospital to home. So next, we're going to show you a video to kind of give you guys a better idea of what we're really talking about.
And this is why we got really excited about this device in the first place.
One-third of all surgical patients do not receive timely pain control, primarily due to the inefficiency of conventional delivery of as-needed medication. Pain management touches most everyone in a hospital environment: physicians, nurses, physical and occupational therapists, administration, finance, and most importantly, the patients and their families. With the current as-needed pain medication delivery system, a series of events must occur to ensure prompt pain relief, and delays are inevitable, especially when a nurse is tending to another patient. It takes a nurse on average 11 minutes to deliver a single dose of PRN pain medication. So a nurse with 6 patients would spend more than 3 hours, or 30% of her shift, just delivering pain pills to her patients. Poor pain control results in an unsatisfactory patient experience, non-productive physician involvement, rescheduling of physical therapy, diminished reimbursements for extended stays, and impacted HCAHPS scores. The solution? Put the patient in control of his pain management. Introducing Medication on Demand. MOD gives patients direct access to their pain management and virtually eliminates the need to depend on conventional nurse delivery. The MOD is an FDA-approved Class 1 device and meets Joint Commission requirements for delivery of pain medication. MOD records pain scale levels and uses a secure passive RFID validation entry system. The MOD is prescribed by the physician, programmed and filled by the nurse, and remains at the patient's bedside during his stay. With MOD, when a patient needs PRN pain medication, he registers his pain on the unit, waves his wristband, and retrieves and takes his medication, all within 20 seconds. Pain is controlled and no longer a stressful issue, giving the patient a better overall hospital experience. The doctors and staff can now focus on patient care, instead of apologizing and diffusing situations. Therapy sessions can occur on schedule, allowing for proper recovery and timely discharge. With MOD, patient pain control equates to better patient experiences and greater patient satisfaction, while reducing up to 30% of nurses' repetitive non-value-added duties, which results in increased bottom lines and better HCAHPS scores. MOD, improving patient care at the bedside.
Okay, so we have our most recent HCAHPS scores here for all the entities, and as you can see, we're doing pretty well, but there's definitely room for improvement still. And again, it's going to take a nurse on average 11 minutes to give a patient 1 dose of PRN pain medication. And after working on a post-op unit where I took care of 6 post-op patients, I can definitely say it took over 30% of my shift just to deliver pain medicine, aside from any other patient care that I was trying to do. Okay, so with a device and giving a patient so much control over a narcotic medication, it's very important to note that this is not a patient that is going to be in the hospital for 3 weeks, 4 weeks. This is somebody who's going to be here for about 1 to 2 days post-op, we want to get them set up for success for discharge. But in order to meet certain criteria, the patient has to be awake, alert, they have to be able to accept the responsibilities of the device, no dementia, no swallowing difficulties in any way, shape, or form. They absolutely cannot have any kind of history of drug-seeking behavior or drug abuse, and then they can't have any physical disability that would prevent them from being able to use the device appropriately.
And you know, some of the biggest concerns that we run into when mentioning this device to our coworkers or other staff is, what if my patient chokes on their medication when we're not in the room? Or what if they take it out of the device and put it in their purse and then take a handful all at once? And the truth is, they can do all of these things at home. So this is why we have our patient criteria, and we're not going to put them at risk for anything that couldn't already happen to them.
And during our research, we did a literature review, and just to point out a few key things, there was overwhelming evidence that showed that the oral is better. You're going to have less side effects, less complications, it's going to be longer acting, and it gives patients more control and more autonomy, which leaves them feeling empowered and like they're actually being a part of their own hospital stay.
So our goal is to implement this device and do a trial run here at St. Luke's. And what we expect to see is those increase in HCAHPS scores for pain management. We expect to see better pain control for our patients with a decrease in post-op complications. And you know, we like to keep our nurses happy. We expect to see that increase in RN satisfaction. And with an increase in positive patient outcomes, we expect to see a decrease in patient readmittance to the hospital within 30 days, all with using this medication on demand device. So next we're going to turn things over to Eric, and he's going to tell you a little bit more.
Thank you.